Hey guys, how you doing? It's Dr. Paul Rieselman here. I thought I would address some concepts and key components of what's called spinal manipulation. A lot of patients ask me about it. A lot of patients are curious to know what is it all about. But a lot of patients ask me what actually is a spinal manipulation and what actually is not a spinal manipulation. It's a very broad, diverse topic. So it's very difficult to explain just in a little 3 to 5 minute segment, but I thought I'd give it a shot. The first thing that you need, actually, let me start over. There's 4 things that you need for spinal manipulation to accurately be a spinal manipulation. The first thing you need is positioning. And through positioning, what we're talking about is the proper biomechanical joint positioning and the proper biomechanical joint motion and function. When a manual therapist is working with a patient, this person is trained in all sorts of sciences of anatomical, clinical anatomical, clinical pathological states of what can happen, so that practitioner can assess, diagnose, and then successfully treat a patient with spinal manipulation. So when the manual therapist is performing spinal manipulation, they must position the patient accurately and correctly based on the biomechanical anatomy, if you will, so that the joints glide and move the way they're supposed to. The superior articular processes articulate with the inferior articular processes, and things can move and glide appropriately. If you don't know how that works or what that entails, you're not going to have a good or appropriate spinal manipulation. The second thing that you need is actually passive relaxation. And a lot of patients ask me, oh, is it okay to crack my neck and do all this kind of stuff? That's a whole nother discussion and answer. But part of the answer when I say no is that you don't have passive relaxation. There's no way a person can passively relax all 6 spinal layers of muscles to successfully perform a spinal manipulation. All 6 layers, superficially to deep, need to be relaxed and deactivated. In other words, not firing, not moving, complete deactivation. So if you don't have passive relaxation of the area in question, then you won't have a successful spinal manipulation. The next important key crucial component is active impulse thrust, okay? What that means is a high velocity, quickly, low amplitude, very shallow maneuver of that joint while the muscles are completely passively deactivated to the anatomical structures that need to move appropriately. And if a non-trained person or someone who doesn't know all those things of how the body works is trying to do something, you're not going to get a successful spinal manipulation. The final thing that you need for a successful spinal manipulation is joint cavitation. Now, we can all, crack our knuckles and do all sorts of things like that, but that's only the last component of a spinal manipulation. You must have the first 3 prior to that, and then move the joint through its proper clinical range of motion, past that barrier that produces cavitation or a crack, and then you will have a successful spinal manipulation. So all 4 of those things, positioning, passive relaxation, active impulse thrusting, and joint cavitation, is what encompasses a successful spinal manipulation. Anyone can crack their joints, move their neck around and all sorts of stuff, hang upside down, all that kind of crazy stuff, but you're not going to get that successful, very specific correction into the area that creates a powerful anti-inflammatory response and allows your body to heal itself naturally. So I hope that clears up any misconceptions, and I hope it educates you guys as to what are the basic parameters of a spinal manipulation. They make books with thousands of pages about this stuff, but I'm just wrapping it up in a 5-minute video. Leave any comments below, leave any feedback, ask any questions, shoot me a blast on Facebook, whatever you want. I hope that successfully educates you and gives you a little bit more information. Thanks so much, and take care until next time.